Hello, everyone. Welcome to Rappler Talk. I'm Pia Renada, and today joining us is Joseph Juico, who is the co-chairperson of Quezon City's Vaccination Task Force. And today we're going to talk about something everybody wants to know. It's when the vaccines are coming and how cities who are the frontliners in this vaccination campaign going to implement the vaccination drives and even persuade Filipinos to take the vaccine, which is necessary for us to combat the coronavirus pandemic. So, Joseph, thank you so much for joining us.
Thank you for having me. Good afternoon to everyone.
Okay, so for a background, no, see, Joseph is the co-chairperson of Quezon City's Vaccination Task Force, and his co-chairperson is no one less than Quezon City Mayor Joy Belmonte, and the Vaccination Task Force is basically in charge of implementing the vaccination drive in Quezon City, which we know is the largest city in Metro Manila in terms of population, and we also know that it has the highest tally of COVID cases cumulatively, right, through time here in Metro Manila. So it's very interesting to know how this city will be managing its vaccination campaign. So just siguro to give us a background on what's happened so far with the task force, QC has already ordered 1.1 million doses of the AstraZeneca vaccine. And today we just found out that the FDA has approved the AstraZeneca vaccine for emergency use. So that's a very good development because it means that QC and all the other cities who ordered from AstraZeneca can actually use these vaccines when they arrive. So these doses are set to arrive July to September, correct, Joseph, in 2021,
Yes.
this year.
Yeah,
And
yeah,
QC has allocated 1 billion in the city's budget for 2021. And then just today, the Quezon City submitted its local vaccine plan to the national government and has also conducted a dry run of vaccinations last Monday, January 25. So, Joseph, siguro just to get things started, is QC working on ordering other vaccines from other suppliers apart from AstraZeneca?
yes. When I discussed this with the task force, particularly Mayor Joy, we're also looking at other vaccine manufacturers. Specific to that, we're in talks also with Johnson and Johnson and also Novavax to see if they can allocate a certain amount of vaccines for our constituents once they get emergency use authorization.
Mm-hmm. Okay, and siguro what can we expect now? Because this is something that people are talking about, right? The different vaccines available to us, depending on the approval of the FDA. So, and many people now have observed that the national government has spoken very highly of the Sinovac vaccine developed by China, but we noticed that a majority of the local governments have ordered from Western firms like AstraZeneca. And so, is this something that QC thought of? Like, what is your perception here there in QC City Hall of Chinese developed vaccines?
Well, I'll talk about first the Western developed vaccines now. The advantage that we see when we decide to engage in talks with other vaccine manufacturers is we look at if these vaccines have already been approved in other FDA or other SRA approving countries. No? Like for example, for AstraZeneca, the advantage why we wanted to engage them is because they got emergency use authorization in the United Kingdom. Same thing with when we got to talk to Novavax and Johnson. What they plan to do is prior to applying here in the Philippines, they would like to get approval first from other stringent regulatory authorities. And then after which, that's what they plan to do here in the Philippines. As to the Chinese-made vaccines, given the size of the city, I don't think the local government can solely procure all the vaccine needs of the city. So at one point, we really have to rely on the national government. And during the launch this morning, we had a conversation with Secretary Galvez, and he assured us that all vaccines that the national government will procure may be a Western-made vaccine or a China or Asian-made vaccine, will go through the same processes like any other vaccine. So, for example, if the allocation to Quezon City are Chinese-made vaccines, then as long as it went through the process, it went to it went through the expert panel, approving body, and it gets approved, then we will have no choice but to use these vaccines as well. We have that naman na they got approved uh, properly.
Mm.
Yeah.
I also remember that you nag-conduct yung QC ng survey on how vaccination is acceptable to QC residents. And I think I remember the figure. It was above 50 people, 50% of respondents said that they would be willing to take a COVID-19 vaccine. But I'm curious, did you also ask QC residents how acceptable Chinese vaccines are for them?
Well, um, there there's actually with that question, 50% said yes, about 30% said answered undecided, and then about if I'm not mistaken, about 15% were were not convinced, or five. I'm not sure, but mas marami yung undecided, no. Anyway, when we asked what's the reason, they they were the ones who suggested, or who came out with an answer that they were wary about Chinese-made vaccines. No, that's why what we plan to do is we have to ramp up our communications plan, our crisis communications, to address all the vaccine hesitancy, particularly to Chinese-made vaccines. That's why now in Quezon City, we started our webinar series wherein titled Sa Totoo Lang, no? Wherein we invited last week Dr. Gloriani, who is part of the expert panel who decides on what vaccines are safe, what vaccines are uh, effective, and she went through all the different brands. And I think that's one way also of addressing the apprehensions of different people with regards to whatever brand is available. That at the end of the day, what we are after here is providing what is the best for our citizens, and particularly to those that live in Quezon City.
Mm. And you mentioned na nga, no, that the national government is also bringing in its own vaccines, and some of these might find their way to Quezon City itself. And yung COVAX facility vaccines might be arriving as early as next month. And how then would be the division? Like, will some of these vaccines arriving in Feb through the national government's efforts be going to QC citizens? And if so, paano yung division of who will receive those vaccines in Quezon City, and how will you prevent like redundancy in your lists?
Okay, well, we're directly coordinating with the national government for the priority list. And once the COVAX vaccines arrive, which, as everybody knows, the target is around February, the priority list would be medical healthcare workers. No? And the national government has been coordinating with us. And I know for a fact that Quezon City will get a sizable amount of those vaccines arriving, because one, they base it on the number of cases. Since Quezon City is the largest city in terms of population, we eventually also have the most number of cases. And actually, they are also looking how ready are cities in terms of their COVID plan and rollout for them to start accepting vaccines from the national government. And I think with our presentation earlier, we got the impression that the national government sees that Quezon City is ready once these vaccines are out.
When you say sizable portion, can you give a percentage?
They did not mention. They just mentioned that since we're the largest city, the most number of cases, they also base it on attack rate, the number of cases per population. That's when they said that, without mentioning an exact figure, that's when they said that Quezon City will get a good number of orders or vaccines coming from the national government.
Mm-hmm. And yung because frontline health workers will be the first in the list. It will be QC though, the local governments who will roll out the vaccines for them. It's not going to be DOH, for example, because they have powers over public hospitals. Paano yung division nun?
Well, for the majority of all national government hospitals are located here in Quezon City. Lung Center, Heart Center, National Kidney. And from what was mentioned to us by DOH, all national government hospitals, it's the national government that will take care in the distribution and inoculation for those sites. Now, as to the private hospitals, they will oversee, but there will be a direct coordination with the private hospitals and the local governments in terms of the release of the vaccines per site. That's why now we are also in talks with the different private hospitals here in Quezon City to get the list and for them to register also in our QCID system, because that will be the main data source for taking into account the number of vaccines that will be released and the number of people that will be vaccinated in their different hospitals.
Mhm. So Quezon City has prepared its list of vaccination centers, and we're going to flash it in the screen. This is the
Okay.
list of centers that you see, which were presented earlier by QC, and you can see there a couple of elementary schools, some covered courts. Siguro, Joseph, maybe you can enumerate to our audience the steps that a QC citizen will go through in order to get vaccinated. Just a brief step by step to make things clear for any Quezon City resident.
Okay, what we did was we divided it into three parts, no? Pre-registration, pre-vaccination, vaccination, and post-vaccination. For the pre-vaccination, that's where majority of the work happens, no? One is we have the Quezon City ID system, which is up and running, but there's certain tweaks that have to be perfected, no? If you register there, there's a question there that would ask you, are you willing to be vaccinated? If you answer yes, um, which if you answer yes, there will be this um, uh, connection or a portion where you click on that will relay that message to the EasyVax support system or page coming from Zwilig Pharma. Now
Mhm.
that page will be the ones, or Zwilig Pharma's database will be the ones that will ask the citizens all the medical history of that person that wants to be vaccinated. And then once approved, they will be receiving a text message and an email alert when your vaccine, what time your vaccine will be, where it will be, and basically it's a scheduling system. And then once you get there, we've already uh, enumerated and identified 24 sites in Quezon City, spread out into 24 areas in Quezon City. So they go there. There is a process that they have to follow. Let me just go through my notes now. First is registration. Basically, they've already pre-registered, no, via online, and then the registration is just to confirm if that is the same person, etc. Then from there, they go to counseling. That's about 3 minutes, and then doctor's assessment to check again the medical history that they filled up, and then after which vaccination, then observation. The total process takes about 45 minutes. The reason why it's 45 minutes because we have to allocate a minimum of 30 minutes to observe the patient after inoculation, just in case there are any adverse events. Then after which they go home, they will receive again a text message or an email for them to schedule for their next jab or their next inoculation. At the same time, from time to time on a weekly or prior to their vaccination, they will be receiving an interactive text messaging to ask if they are feeling any symptoms as part of the study also being done for monitoring on the vaccine.
Okay, you mentioned this Q Citizen ID, and it will
Yeah.
take internet connection to register. No, is this a portal, a website? Can you inform our viewers where to register?
We have a we have a website. Well, our Quezon City government website. You go through that website. It's also available on Facebook. And then after which, there's a portal within the website that you click on if you want to apply for the Q Citizens ID. Now, the Q Citizens ID, it's not just for vaccines. This is basically for you to identify yourself if you're a senior citizen, and then after which, whatever benefits that are due to senior citizens, you get it. If you're an indigent family, there are the certain benefits. So basically, it's a it's hitting two birds with one stone by promoting all the benefits and getting to know all the different types of services the Quezon City can avail of. Nandun na rin yung vaccine program namin para at least everything is centralized to our system.
Mhm. And how do we deal with, or how do you respond to people in QC who do not have access to internet or computer? How can they access Q
Uh,
Citizens ID?
okay, we'll be rolling out also kiosks that will be located in different barangays and different areas in Quezon City. For example, senior citizens, especially indigent senior citizens, I do not think they have access to a cell phone or to internet. So what we plan to do is go down to the barangays, schedule for them to go to an area like or for example a basketball court for them to register, no, because we need a big area to promote social distancing. For example, if obviously they are a priority group to be vaccinated. They want to be vaccinated, so we issue a hard copy of their confirmation slip to be vaccinated. And in that hard copy, there is a QR code that will identify them once they get to the inoculation site.
Are you anticipating any challenges, like, let's say, no matter how well your communication campaign is for Q Citizen ID, na may dadating pa rin sa vaccination centers na never heard of the Q Citizen ID, and what happens then? Will you turn them away from the vaccination centers?
Well, that's something that we're discussing right now. No, those that will probably walk in. No, the thing is, what we plan to do before we confirm the orders coming from the central warehouse, we have to be sure that the number of people that are in the inoculation site are more or less the same number of vaccines to be delivered. Because as you know, these vaccines are very sensitive to temperature. So with the walk-ins naman, for example, this is just a point of discussion. No? There were about 10 people that confirmed to go to the
Mm.
inoculation site. And then about 7 people arrived. And then after X number of hours, the 3 other people have yet to arrive. And then there would be walk-ins that would
Mm.
like to be vaccinated. Then those are certain aspects that we have to consider, just that so that the vaccines won't go to waste. No, and I think that's the common problem, not just a problem that we are foreseeing, but it's also a problem that's happening all over the world. No, that X number of vaccines, X number of people are expected, not the X number of people would be there. So now they end up getting try to look for people to volunteer
Mm.
just to have that vaccine used.
Mhm. And so, I'm sure that you've witnessed this, like you mentioned, no, other countries are already rolling out their vaccination drives. And I'm sure you've been observing or trying to find out any mga challenges confronting them, especially in maybe tropical countries like ours. Apart from what you mentioned, na yung parang mali yung waiting list is hindi nagtutugpa palagi with the supply available. What other challenges do you foresee on vaccination day that LGUs have to prepare for?
Well, uh, I guess that's the number one problem, actually getting people to the vaccination site. Well, aside from getting the first dose, the number one challenge is for them to go back to the vaccination site to get their second dose.
Mm.
And I think that's been a major challenge for all countries. No, so I guess it's all about the messaging again. No, trying to convince them that the vaccine won't work on its optimal level or best level if they don't get vaccinated twice. No, so they have to do it 2 times. No, aside from that, definitely the main challenge also that Quezon City uh, might uh, uh, might feel is the manpower. No, the manpower requirement for us to address uh, to put up for the vaccination site, we need around 648 people, a mix of doctors, nurses, encoders, to fully complement the 28 sites. And so far, the Quezon City local government has around a little over 320 people, no? So basically, kalahati pa lang
50%.
yung nako-comply namin, yes. So what we're doing now is we're getting in touch with different medical associations. We're talking to the private sector, the private hospitals, to see if they can help and augment some of their personnel to help us with this initiative. Because at the end of the day, it's a whole of nation, whole of country initiative, whole of city initiative to inoculate as many people as we can. So I guess those are the two main problems that we are foreseeing. But I guarantee you, Pia, once this rolls out, the list might get longer because this is a novel thing that we are all will be faced with.
The 1.1 million doses of AstraZeneca doses, QC has already identified who in Quezon City will receive those doses. Can you just enumerate how many millions will, or sino-sino yung mga taong mag-receive ng 1.1 million?
Okay, well, for the 1.1 million doses, that's only good for 550,000 people because it's 2 doses, no? But what we did was we created a priority listing already, no, of the sectors that have to be addressed, no. So obviously, when we created that, it's even way above the 550,000 people that will cater dun sa 1.1 million doses. For the priority listing, it's already at a little over 1 million. No, but if we, from the priority list, if we focus on the medical healthcare workers and the senior citizens, indigent senior citizens, the 550,000 people will be, those two sectors can be included in the 550,000. And the rest, it's either we procure some more or we also get the allocation coming from the national government. Is it okay if I run by you the priority listing? Like, for example, for the Quezon City Health Department or health care workers under the supervision of the Quezon City local government, that's a little over 3,000 people already. Our BERTs or Barangay Health Emergency Response Teams, that's already 1,410. The private health workers, it's already a little over 18,000 in the private hospitals. And then the priority groups, such as the senior citizens, it's already 300,000. And the major priority group are the indigent persons, no? This used to be a higher number, but since those that have to be inoculated should be 16 years old and above. So from the indigent sector, that's around 703,000 people already. There's 20,000 uniformed personnel and an additional 20,000 persons with disability. So obviously the 550,000 doses, for 550,000 people, which is 1.1 million doses, it's not enough. So it's a balancing act also, but we will have to follow the priority listing.
And again, yung list na to, it's all contingent on whether the people in this list can get a QCitizen ID, correct?
Correct, yes. And if they say yes to be vaccinated as well.
Right. Are there requirements to get this ID? I mean, ano yung mga IDs involved, and is it something that they can just do online purely?
No, they can do it online. They can also do it via kiosk because we will be going around, putting up different areas for them to apply for ID. At the same time, we're rolling that out siguro in the next couple of days. But the focus now for the QC ID application form will be in the different hospitals. We'll be putting kiosks up there so that they can register as well.
And siguro, no, towards the last part of this interview, yung concern talaga on storage of vaccines which require ultra cold or cold. You already mentioned a little bit about this, that you're working with Zwellig Pharma. So can we just illustrate to us, no, where exactly in QC do we store these vaccines? Do we have enough facilities for this? If not, what are we doing to augment our facilities?
Well, number one, the storage of Zwellig Pharma is not in Quezon City. It's in Santa Rosa, Laguna. No, it may seem far, but with the new expressway, we did the time and motion coming from their warehouse. It takes around 30 to 40 minutes to deliver it to to one inoculation site where we did the time and motion study. Why did we talk to Swilig Pharma instead of putting up our own uh, um, cold, uh, cold, uh, uh, cold chain warehouse or our own warehouse? Number one, uh, I don't think Quezon City is capable to handle this magnitude or this big of a storage facility. And we need a medical grade warehouse. And Swilig Pharma has that already in place. They have the expertise, they have the temperature control, they have the manpower to be sure that all of these vaccines will be stored properly so that once it gets to our inoculation sites, the, the, the effectiveness of the vaccine is still there. Why Swilig Pharma? Why did we talk to them? Because they have all the degrees necessary to store a vaccine. For example, if the national government says, Quezon City, we have for you Pfizer vaccines. Swilig has a negative 70 cold facility. If we have a Moderna vaccine for you, they have a negative 20. Even if it's the regular temperature 2 to 8, given the size of our city, the number of vaccines that have to be stored. So that's why we dealt with that. Then rather than putting up our own warehouse facility, which I don't think will be enough time for us to do that. No.
Mm. Okay. So your last na lang, Joseph. A lot of other local governments are, 'di ba, looking with awe or maybe with a little bit of curiosity at how cities, for example, in Metro Manila, are moving forward with their vaccine plans, and a lot of LGUs, diba, don't always have the same resources or funding as cities in Metro Manila. So, as someone who heads the vaccine efforts of your city, what would be your biggest tip, advice for local governments who are just right now crafting their vaccine plans? What has been the most helpful for you and Quezon City so far?
Well, if number one is for them to coordinate with DOH or World Health Organization to get tips on what is how to roll out a vaccine plan. No? But definitely, they have to study the existing infrastructure that they have and also the manpower component. Without the infrastructure, without the manpower, it's very difficult to create a plan. But for example, if it's a third or second class municipality, definitely the provincial government should take the lead in trying to organize all the different municipalities and other cities to support one another and to help one another. I guess the difference between Quezon City and the different municipalities is, aside from the size and the number of people, it's easy to manage certain municipalities because they have very little or little relatively less population number of people compared to Quezon City. So my advice is definitely to create a roadmap, to create a plan, and then from there, whatever holes or gaps that they have, for them to also coordinate with their private sector groups, for them to coordinate with church groups, for them to coordinate with the national government. And with Quezon City, we're lucky enough that in-house we were able to pull different people from different departments in our city. We're wearing multiple hats here. And to see, like, for example, the head of our cold chain, who is the head of our local economic investments promotions office, he used to be in the private sector who was very active in the supply chain process. So he was able to adapt his knowledge to use in this endeavor of ours now, no? So it's a matter of tapping different talents and to see how to pull together and figure out what would be the best plan. But I tell you, there's no best plan here, no? It may look good on paper, but the proof is in the proof in the pudding is in the eating. So it's all in once we roll out and see if it will actually work. No, we're crossing our fingers that it does work.
And apart from inviting experts to talk about how vaccines are effective and safe, how does QC plan to override or convince citizens in your city that to have themselves vaccinated? Because we know nga na yun, the fear of Chinese vaccines, for example, and then even this the vaccine controversy, which diba, set back our vaccination drives by a lot. So what other ways do you see this happening? I mean, for example, are the local officials in QC planning to have a public vaccination? What other ways are you looking at?
Actually, yes, the mayor already when she was asked in a prior interview, would she be vaccinated in public? She said yes, but she wants to be vaccinated in the arm. All of us, all of us, I'm with her also. As long as the priority sectors would be addressed first, and if there's room for us and for the mayor to be vaccinated, well and good. Yes, she's willing to take that step just to show everybody that it is safe, it is effective, and that we've also studied it with the experts that this is something that we need to move forward. Aside from wearing our masks, being socially distanced, implementing social distancing, washing of hands. This is the fourth step. And it doesn't necessarily mean just because you're vaccinated, you forget all three other main components. The only way that we can lessen all the three other components if we get around 70 to 80% of our population immunized so that we can generate some sort of herd immunity. So yeah, we're willing to do that. Pero sa arm.
Oh, of course. Okay, that was very informative. I'm hoping that Quezon City residents and even those who are outside Quezon City learned a lot from what you just said, what you just explained. Best of luck to Quezon City in implementing its vaccine plan. Thank you again, Joseph, for joining us today. And thanks for
Thank you so.
watching Rappler Talk.
Okay, thank you, Pia. God bless and stay safe.
Thanks.